We're getting to the point where you can't live with losing. Democrats like myself are horrified by what we're seeing. Republicans seem to have been horrified by what Obama was doing. And there just doesn't seem to be a lot of room for compromise in the middle.
The country would be a lot better off if we got to a level of bipartisanship on health care that we haven't had to date. And that goes back, honestly, from my perspective, to enactment of the Affordable Care Act. I mean, there's a lot of water under that particular bridge about who's to blame for what, when.
We need to figure out how to grow from here, to stabilize our provider community, to provide coverage to more people who need it, without spending, the next generation's future in the process of doing that.
So the state of reform is really quite amazing, because I think to have a conversation with folks that you don't really know that well, you have to understand where they're coming from. It really is understanding each unique part of the healthcare system so that we can understand a very give and take philosophy, looking for a co-created outcome that's really patient-centered, but all parts have to be kept whole.
This is a good slate of different topics. They're timely, they're big, they're meaningful and impactful for us, and we have the right people in the audience and on the panels to really engage.
It's really hard to continue to be cutting edge when you don't know where the funding is coming from Washington. Decisions are being made. But just like John Backus and others had said during their presentations of talks today, they are really doing things outside the reliance on CMS to drive change. It's kind of what California's always been about.
Next year, DJ, when you come and have this great forum here in San Diego, that we don't bring the same audience. It's all of you plus one. But the plus one would be the folks that are in employment. The plus one would be the housing authority. Plus one is your fire chief, police chief. Plus one could be a legislator. That we bring others to help connect the unconnected to what it is we're doing so they could better understand this social movement we're doing around wellness.